bet you floss, don't you? Yeah, I know you do. The day right before your dentist or hygienist visit. But what about the other 360 odd days of the year? Look, I'm Dr. Rachel, holistic dentist, and I'm going to say something that may shock and surprise you. I don't floss. Yep, that's right. I never floss regularly, and I haven't done so for years. But I encourage people to floss, and I've even done videos on it. But the question I'm going to answer is, do you really need to floss? And if you don't need to floss, is there something you should or could be doing instead? So I'm going to say it again. I don't floss. What? Did the dentist just say they don't floss? Yes, I did. But before you freak out, I'm going to explain why. Is it because dentists have some superpower that keeps their gums healthy? Well, no. It's because there's actually other ways to clean between your teeth, and I do that instead. Because to be quite honest, I hate flossing. And personally, I think unless you have a brilliant technique, then other for getting food that's stuck between your teeth out, flossing is quite pointless. It could even be harmful if you have gum disease and bleeding gums, because you can push food down into your gums and make things worse. Yet, cleaning between your teeth is actually super important because bacteria thrive in those gaps and spaces where the teeth lean against each other. You're going to get food and plaque caught, and if you don't clean that, you're going to have problems. And look, lots of patients get cavities between their teeth, and gum disease often starts there as well because this is a place you can't reach with your toothbrush, and plaque build up, and they avoid getting disturbed and moved along. So once the bacteria start to breed and multiply, the gums can easily get inflamed in those areas. So to prevent this and reduce your risk of getting tooth decay and gum infections, you do actually need to clean between your teeth properly. Now, notice I said you need to clean between your teeth. I didn't say you had to floss them. But you do need to clean where the toothbrush can't reach, otherwise about 40% of the teeth surfaces are getting left dirty, and this can cause problems. So let me tell you about how I clean between my teeth and what things you can use to clean between yours that just don't involve flossing. There are 3 alternatives that you can actually use instead of flossing. The first is floss picks, like this. And to be honest, I hate them. I hate them more than floss, and I will tell you why later. So if you use those, or you were thinking of switching to them, you're going to want to keep watching so you understand why I can't stand them, and I think they're a really bad thing. So okay, those floss things, they might be better than nothing at all, and I'll go over that more shortly. The second thing are these, interdental or proxy brushes. Let me get the cap off. I love these. I absolutely love them. They are great. They are great for so many patients. But sadly, so many people don't know about them. They don't even know what they are. And dentists keep telling you all to floss. And they don't even offer any other recommendations. Now these little brushes, they come in different shapes and different sizes, so you can find the ones that fit between your teeth. You can find the ones that fit specific areas of your mouth. Now, they're brilliant. They remove bits of food, they clean away plaque, and they massage your gums without doing any damage. And what's more, they're super easy to use, and they're great if you've got bridges, implants, or orthodontic retainer wires like I have. They're also great if you don't like putting your fingers in your mouth because you can kind of do it from back here. You simply push them into the space just where the tip of the gum sits between the teeth, and you go back and forth a few times to clean out any nasties. You can even dip them in a bit of mouthwash or put some toothpaste on them if you like. I like to do that. Then there are water flossers, and again these are great for cleaning between your teeth. I particularly like them for my patients who have wide spacing, gum recession, or gum pockets where they've had bone loss. where there's been advanced gum disease called periodontitis. Now, if you're going to get a water flosser, get one where you can adjust the strength and intensity of the water flow and make sure it's got a water reservoir. And in that way, you can add to that water reservoir. You can put warm water in as well, which is sometimes more pleasant. And you can add some mouthwash, or you can use some 3% hydrogen peroxide, and that's going to act as an antibacterial for your teeth and gums. Now, what's going to work best for you? Well, that's going to depend on your teeth, your dental history, and your gum health. So I'm going to suggest you ask your dentist. That's a good idea, because then they're going to work out what's best suited to your situation, and not just because flossing is a challenge and hardly anyone, including me, do it. So let me come back to the floss picks. I've tossed it across the room so I can't even hold it up for you, and why I hate them so much. Well, lots of people like to use them, but I think they are useless. They don't do a good job of cleaning in between your teeth. Yes, they're going to clean where your teeth touch each other, but they do a terrible job when it comes to keeping your gums healthy and getting rid of plaque, because they're going straight down and you've got a space that widens out. They just don't do a good job. And the reason they were invented was to help people with poor manual dexterity. You know, just people who could not physically floss. It was impossible for them, such as the elderly, someone with special needs, or mobility issues with their fingers. So like if you've got arthritis. But you can't control a floss pick very well. That piece of floss in the middle, it can end up, as you push it through, it kind of stretches and then it goes snap. And it bounces up too hard against the gums, and that can traumatize or even cut them. You also can't curve it around the side of your tooth. It will not hug around your tooth. I mean, flossing is like towel drying your back. You've got to curve it around. So those floss picks just don't do a very effective job, because it's this straight piece of string rubbing up and down. So, if you hate flossing and you have been using floss picks, I would really sincerely like to encourage you to give these interdental brushes, Pixters and TPs, I'd like you to really give them a go, because they are going to provide you with a superior clean with no risk of damage to your gums, and they're pretty easy to use. Now, I'd like to say a bit more about water flossers, as they're a great way of jet washing your teeth and blasting out bits of food. And unlike floss, it won't push food further in, causing a food pack and possible gum irritation and inflammation. Now, this doesn't mean if you're flossing daily and you're doing a good job of it, that you should just throw your floss in the bin. But instead, keep going with your flossing and perhaps add in some interdental brushes and water flossers to the mix, especially if you've got areas where you get a lot of tartar buildup, for example, and this will help reduce the amount of plaque formation in that area. It's good if you've got pocketing or bleeding that the dentist or the hygienist have pointed out to your routine exam. You know, like if you have this ongoing problem area that doesn't come under control. So essentially, to quote Will Shakespeare, to floss or not to floss? It's not really the question, actually, but what's best to clean between your teeth with? So for me, it's interdental brushes. For you, it might be floss or the water flosser. At the end of the day, like literally, at the end of the day, just before bed, we want you to be cleaning in between your teeth properly. So it's up to you how you do it. Now, if you've been doing all this and you've been keeping your mouth clean and yet you still get cavities or you've got bleeding gums, I suggest you watch this, which is one of my most popular videos here, and it explains how to cure and prevent dental disease with supplements and nutrition.